My name is Mercy OSORO. Mercy OSORO is also a staff in NCI. I'm also a cancer warrior. I was diagnosed with Hodgkin's lymphoma. It's a subtype of lymphoma. And I've survived. This is now my 19th year since I was diagnosed with the cancer. I was diagnosed in the year 2005. The journey was not easy because I had a swollen mass on my neck that right now it's not there. It was so big and it was coming slowly. It was just swelling slowly. It wasn't painful, but it was just swelling. So I was taken to the nearest dispensary. Nothing was diagnosed at that point. They only gave me painkillers. Then when I went home, the mass persisted swelling, and then I just went on with my education. By then I was a teenager, but it wasn't when I was in class 8. The mass was too big until my neck. I was just walking while bending the neck. I was taken to Moi Teaching and Referral Hospital, where my diagnosis began. Later on, we went to Medihill Hospital, where I underwent the surgery. The biopsy was done through that surgery. Then during those days, we used to wait for 3 weeks for you to get your results. Then the results came back positive that I had cancer. It was so difficult to my family to accept, but they had to. So one of the pediatric oncologists was consulted, Dr. Constance Tenge, who is now a professor, and she took me through the treatment. She advised my parents that I'll be going for 12 cycles of chemotherapy. Then I began well, the first one, the second one, then the third one. During those days, there was no NHIF, so my dad had to look for finances for me to get the treatment. But when I went through the 3 cycles, the mass subsided, and I looked to be okay. Then my dad made a decision that there's no need for the treatment because the mass has gone off. We can now stop there the treatment. But in the real sense, he had no money because there was no NHIF even to cater for medication. So I stopped the medication. After a year later, the mass came afresh to both sides, and they were really big and they were so aggressive. So I had to go back to the hospital, and I met again with Professor Tenge. Then she advised on medication again, and she told me you don't need to stop the medication before it's over. So I began again from cycle 1, cycle 2, but at that moment there were no drugs. So I used to wait for other patients who had money to buy the drugs, and then the leftovers to those bottles of drugs, they were used to treat me as Mercy. And I went on with the treatment from cycle 1 up to the 12th cycle. I completed in the year 2007. After completion of treatment, later on I encountered some side effects of the drugs. I got some very serious side effects that I'm living with to date. My heart was affected. I had a left side heart failure that I was diagnosed with in the year 2007. I began treatment in the cardiac center. The drugs that are very, very expensive that I'm using up to date. So the treatment of cancer has its own side effects that most of the warriors are going through right now, that you have to use drugs in your lifetime. So that's what we are pleading as the survivors, as the warriors, that even in the medical cover, that the survivors to be considered. And I could also wish to encourage the parents to as a parent, when the child is diagnosed with cancer, in that I'm a childhood cancer survivor, make the right decision to your child, because if the right decision was made to me, I couldn't have dropped out of medication. And also I would like to encourage those who are diagnosed with cancer that cancer is not a death sentence. We are here, we are living. I'm living a normal life. I'm like any other person who has not gone through any medication of cancer, and I'm doing very well. I'm doing my duties as an officer in NCI, even back at home. So cancer is not a death sentence. I'm here to encourage you that when you're diagnosed, just follow the instructions of the doctor and you will come out strong, like here we are. As a survivor, I encourage parents to allow their children to go through the HPV vaccine to control this cervical cancer. And even for men, for prostate, it's good to go for checkups. Do frequent checkups to know yourself better, and you will save life. And also even for lymphoma, parents, be checking your children for these lymph nodes. Sometimes they can begin without you knowing. Check your boy, check the lymph nodes. How are they? An early detection saves life. There is this dawa ya kienyeji. It is called sagithiet in some areas. You find that when you are diagnosed with cancer, then you are taken also, you are being told with those old people that you go for herbal medication. Herbal medication doesn't help. I used it and it never helped me. It kept on worsening the situation, because this herbal medicine, they don't have the dosages, and they don't know, the research has not been done about them. So when you are diagnosed with cancer, kindly follow the doctor's instructions. don't go for herbal medications. They don't help. They never help, and they never helped me. Thank you.